attendance just because I have the list right here for the minutes, and then I'll hand it over to you.
Okay.
All right. Well, welcome everyone to the Region 3 Planning and Policy Council meeting. Looks like we have 25 individuals on the call. That's great. Thank you for taking the time to attend today. My name's Kirby Fye. I'm with the department. Just a few things to go over before we get started. Per the Open Meetings Act, this meeting is being held virtually. The council decided that it would just make the most sense to keep everyone safe right now, especially with the new variant going around. So we're continuing to hold it virtually this quarter, all of the regional council meetings actually, and then we'll reassess next quarter to see what's safest for everyone. So with that being said, this meeting is being recorded and it will be posted to the department website within the next day or two. So please state your name before you present or ask any questions. It's helpful for the minutes. And also please make sure your phone or computer is muted when you're not speaking, just to prevent any feedback from coming through. I'm going to go ahead and do the attendance quick. And I'll start with the individuals who have joined via MS Teams because I can see your name. And then I'll go to the individuals who have called in. So like I said, my name's Kirby Fye. I'm with the department. We have Brad Franks, Amy Irvin, Anna Pratano-Biggs, Avis Easley, also with the department, Danielle Beck, our new secretary for Region 3, Jordan Foster, Gail Lodato, our vice chair for Region 3, Gina Turley, Glenn, I don't see a last name. Can you please state your last name, Glenn? I think you're muted, Glenn. Okay, we'll come back. Jennifer Dillard.
Sorry, I had another app running on top of you there, so I couldn't get to the unmute. My name is Glenn Sayes, S-A-Y-E-S, with
okay, welcome. Thanks, Glenn.
With UCHRA.
Thank you. Jennifer Dillard, Callie Tinnell, Kara Coleman, Kathy Milam, Kristen Veloff with the department, Kubra or Cal Bryant. Let me see. Laura Pierce, Missy Zenson, Nicole Bates, Rachel Geringer, Sarah Waldrop, Susan Green, Trish Cunningham, Zach Blair, also with the department, and we have a few individuals that have joined via phone. If you can please state your name.
Good morning, this is Debbie Loudermilk with Cadis.
Hi, Debbie. So I have Debbie Loudermilk. I think I heard Donna Maddox too. Is that correct?
Correct. And I just got audio too. Thank you.
Thank you.
Thank you. We have one more person or two more people that joined via phone. Can you please state your name?
I'm Kristen Smith and I'm with Park Ridge Valley Hospital.
Hi, Kristen Smith. Is that correct?
That's correct.
Welcome. We have one more person.
This is Jimmy Catlett with Johnson Mental Health.
I'm sorry, can you state your name a little bit louder?
Jimmy Catlett.
Hi, Jimmy. Thank you. Welcome. Have I missed anyone for attendance? All right, Gail, I'll hand it over to you.
Okay, well, good morning, and thank you for joining this morning for our Region 3 Planning and Policy Council meeting. I do want to share that our chair has had her baby boy. His name is Owen. He's 3 weeks old today, and he joins another brother. So we decided that we'd give her a few more days off. But I expect Deanna to be back for the next meeting. So you're just stuck with me for this meeting. And I did want to also, I know that we mentioned briefly, Kirby mentioned that we have Danielle Beck. I just want to thank her for taking on the role as our secretary. I want everyone to be patient, not only with me, but with Danielle as we stumble through. But please know that we really have a strong interest in making sure that we're including everyone, that information is shared with everyone, and that we're accurately documenting so that anyone that misses the meeting is able to not only view, which will be on the website, but also be able to reflect and read back. So thank you, Danielle, for what you're doing today. We don't have minutes from last meeting. There was none documented, but I can, Kirby, if you think it's appropriate, I can share what our discussion was.
So Gail, what we did, so we all, as you might be familiar with, we had some transition with the secretary for Region 3. So I met with Danielle, and she's going to actually work on the minutes. So thank you for being patient with us. Thankfully, these meetings are being recorded. So she's going to take care of the minutes, and we're going to send it out via email for everyone to approve on within the next week or so. So just be on the lookout. Yeah, now we're rocking and rolling going forward, right? Right.
We sure are. Thank you. And then so we'll have our minutes then sent out via email, right, Kirby? And then we will do an approval via email. Is that correct?
Yes. So just when you send them out via email, if someone would just motion to approve and then motion to second the minutes, we'll be good to go. And then you can just document that in your next meeting.
Great. Thank you. Before asking Kirby to give the report from the department, I just wanted to make sure that everyone on the call has, and I'm going to give a real broad overview of what our role is. And probably for a while, Deanna and I will start the meeting with this just so that we can keep ourselves on track. There's a lot of wonderful providers and community members and service recipients on this call and at this meeting, and I want everyone to have a voice, but I want to make sure that we're all focusing on what our purpose is of meeting. And so very briefly, we have our commissioner at the Department of Mental Health and Substance Abuse, Commissioner Marie Williams, and she looks to each region. So we're all divided into regions, and we happen to all be in Region 3. And she looks to us as her planning and policy regional committees and councils to help her keep updated with any challenges that we are experiencing in our region, any ideas and collaborations that might warrant additional support, certainly where we may want her to consider allocating funds is important. And that culminates each year in our April needs assessment submissions. And so we break into subcommittees. We have an adult subcommittee, a children and youth subcommittee, and a legislative subcommittee, so that we can take the information that is brought up in these meetings, and then we can meet in smaller groups to really hash those out, get data, determine what are our regional issues, so that when April comes, we can present the commissioner with a really solid report. Sometimes it includes an actual recommendation as to what we would like to see happen, again, whether it's budget or some other kind of support that we need legislatively. So that's the purpose of our meeting. Certainly we want to hear from everybody as to events and outreach and support that's in our community, but we want to really make sure that we're focusing on what our purpose is. So hopefully that's helpful to some of you that are joining for the first time today. And hopefully it's a good reminder to those of us that have been doing this for a while. So with that, Kirby, I will ask you to give your report.
Well, that was great. That was a great explanation, Gail. That was wonderful. And like Gail said, and this is something in all of the regional councils. There's 7 of them. There's also, every regional council looks different. So you might have more providers on a council or more advocates on a council, but every regional council is also looking to recruit more individuals with lived experience or family members of individuals with lived experience, especially to have those voices heard when developing the needs assessment process. And as you know, Region 3 is huge. What is it? It's from like one state border to the other state border. And hopefully once we start meeting in person, I do believe that if we return to the Ames Center, I do believe they have the capability to do conference call where individuals can call in. So if you have anyone in mind that you notice that should be at this meeting but isn't at this meeting, it might be helpful to recruit them. And if distance is an issue, especially while we're meeting virtually, this would be easier for them. But the option for conference call in, I'm almost 99% sure is available at the Ames Center, so that they can continue to participate no matter what county they're from. So just a little heads up, it's a new fiscal year. Just think of those individuals that you think should be here but aren't here. And I'm going to go ahead and pull up, I have an update. Let me pull this up. Just a few things to go over since our last meeting. You'll get an email about this soon, Gail and Danielle, that you can share with your council members as well. But I just wanted to put this on your radar since we won't meet again until after this is due. Please identify your region's key accomplishments achieved and challenges faced from July 1, 2020 through June 30th, 2021, and your region's future plans. I'm working on the FY21 Joint Annual Report. This report is produced and delivered to the governor and state legislature to highlight accomplishments, challenges, and plans for the future. This report is a collaborative effort between our department, all 7 regional councils, and the statewide council. So this is really your opportunity to highlight what's going on in your region, successes you've seen, challenges you faced, and it goes into this report, my favorite report to do, because it really highlights all of the good work that you're all doing. So please take the time to really do this and highlight your region. This is due to me via email no later than September 17th. So we have quite a bit of time. And like I said, I'll send out a reminder email here within the coming weeks. Year 3, fiscal year 2022 of the 3-year plan is in progress. Once completed, the regional councils will have an opportunity to review. Development of the FY22 mental health block grant is also underway. Statewide and regional councils will also have the opportunity to review that document as well. The 2021 legislative summary is complete and it's been posted to the department website. I've included the link in my update, which I'll send to you, Danielle, so that you can include it in your minutes. I'm going to allow Zach to go into more detail about that. Zach Blair, he's on the call. He's going to go into more detail about that with you all after my report. And last but not least, the department is releasing a new certification for peer support specialists designed specifically for young adults with lived experience of mental health and/or substance use challenges. The Certified Young Adult Peer Support Specialist program is tailored to young adults in both design and language with a target age range of 18 to 30 and a requirement of 1 year in recovery. The program includes a 1-week, 40-hour training session covering topics including responsibilities and expectations, strategic sharing, youth empowerment, positive youth development, and trauma-informed care. Through the training, these specialists will gain the knowledge needed to provide youth and young adult-friendly peer support services to individuals under the age of 30. Peers certified through the program are also required to complete service hours and continuing education to maintain their certification. The program joins the department's current offerings in peer certification, the Certified Peer Recovery Specialist Program, and Certified Family Support Specialist Program. I have included a link on our department website where you can find more information about this program as well. And that is what I have.
Excellent. Thank you very much. I guess I should have shared that too, Kirby, that not only is the purpose of this meeting for us to collaborate together on what our regional ideas and concerns and challenges are, but also to have the opportunity to hear from you what's going on at the department. So thank you very much. Zach, are you ready to give us a review of the legislative summary?
Good morning. I am. Thank you so much. The first thing I was hoping to do, if it's okay with the group, Kristen Veloff has joined our department as our new Assistant Director of Legislation and Rules. And Kristen, if I don't know if you can pop up for a second, or I may be on my screen and can't see you with the large group we have today.
Yeah, Zach, I'm here.
Great. So Kristen is in our another team member at my house. My dog would also like to join the call, apparently. Kristen joins us from the Tennessee Board of Regents. She was formerly the Assistant Vice Chancellor for Government Relations for the Tennessee Board of Regents system. And Kristen and I worked together at the Department of Children's Services for a few years in the legislative team there. And so I'm really excited to have her. As you know, our department has grown and more attention from the legislature, and in our budget continues to increase every year, and our workload as a result from the legislative process has increased as well. So it'll be good to have another support, another person for us. So Kristen, I'll let you introduce yourself and tell everyone hello.
All right. Well, good morning, everyone. It's so nice to see everyone's faces and meet you. I look forward to working with you. Zach kind of gave you a little bit of my bio, so please reach out if you need anything. I definitely want to help, and I'm just excited to be here and be part of the team and help in all the good work you guys are doing.
And hopefully I've appeased my dog enough where he's not barking anymore. So hopefully y'all can hear me a little bit better. Gail, does that sound better? Good. Okay, thank you. I'm going to go ahead and share my screen real quick and pull up the legislative summary. Is everyone able to see that? Okay, Kristen's on her head and I can see her in my window, so that's good. So the legislative summary has been posted to our website. You can access it there. Feel free to print it off if you'd like, but I encourage folks to use the electronic copy because it has some clickable links that you can use to read the legislation and access all the relevant documents for the legislation. So I've got several bills on here, but I will stick to those that I've highlighted. And if for some reason you see another bill on there that you'd like to ask questions about, please feel free to do that at the end. And we'll go through this real quick. And I'm looking forward to answering any questions you may have about the process this year and any bills that pass. So the first one that you'll see on this list, HJR 175, is a joint resolution that the legislature used to honor Ellen Abbott. Those in our recovery court community and our criminal justice community know Ellen very well, and we were very unfortunate, and we sadly lost her at the beginning of 2021. And we were very grateful that the legislature honored her in this way. So if you'd like to review the text of that resolution, that's there, and we thought it was very fitting to include that at the top of our legislative summary for this year. The next bill that I'd like to talk about, Senate Bill 753, House Bill 81, now Public Chapter 62, was an administration bill that our department asked for and received and passed during the legislative session. The relevant portion of this bill, and something that we talked to the councils about last year, the regional planning and policy councils are not actually found in statute. They were a growth of the statewide council, and there was some confusion during the sunset review process about membership and if the membership requirements of the statewide council also went down to the regional council. So we wanted to just add some clarifying language that the department and the councils will strive rather than require that a majority of members of each regional council are former service recipients, family members of service recipients, or prior service recipients. So this is something that we thought was important to include as intent in legislation, but it doesn't put that same requirement since the motion or the membership of the regional councils tends to be fluid and it's locally governed. Obviously it's a little bit more difficult to make sure that requirement is being met on the regional council level, but we want to make sure that that's definitely a goal, but it does provide some flexibility in membership for that purpose. And I know Kirby talked about that during her presentation, and please continue to be mindful of that as you create membership for these councils. The second thing that I think will be helpful, there was some confusion with the telehealth legislation that passed in 2020 regarding licensed alcohol and drug abuse counselors. And this bill just made it very clear that those practitioners can provide services via telehealth or telemedicine. So again, just wanted to be abundantly clear. Even though that was the intent of the legislature, the language and statute was a little confusing. So wanted to clean that up, and happy that we have that provision for those practitioners. Moving to the next page, the last bill on this page that you'll see, Senate Bill 739, House Bill 73, now Public Chapter 595. This is the K-12 Mental Health Trust Fund. And I know many of you heard about that. This was the governor's initiative to set aside $250 million, $225 million of that goes into an account that is growing on investments on a regular basis to then put recurring funding into the other account, which will start with an initial deposit of $25 million and will move on to provide services. I apologize, everybody. He's my dog is normally pretty calm, but he's also the world's greatest door opener. So anytime he hears something outside, he decides he wants to tell everybody about it, which is great normally, but not fantastic for conference calls. But going back to the K-12 Mental Health Trust Fund, the trust itself will earn money on a regular basis. The money from those proceeds and investments will then go into an account that will be allowed to be used to serve students in a K-12 mental health environment. So we're really excited about that initiative. Obviously, a large investment by the governor and the legislature for those services. And we're really excited to see the fruits of that labor as that fund continues to grow.
Hey, Zach, can I ask a question?
Sure, absolutely.
This is Rachel with TSPN.
Yes, ma'am.
Is it already dictated? Can you guys hear like feedback?
I'm hearing you perfectly fine.
Okay, I can hear myself.
I hear a lot of feedback, Rachel.
Okay. Hopefully I'm not anymore. Okay. Is it already dictated like what programs and services this funding is going to go into, or like how will that be determined? You said it's specifically for K through 12 schools. Does it go to the schools? Does it go to organizations that serve the schools? Is any of that known?
So the bill doesn't speak to specific programs that are required to be funded. It does say that these are for prevention, treatment, and intervention services for that population. So what we are going to do as a department is we're going to perform a needs assessment throughout the state to get an idea of what services and needs are throughout the state, and then funding will be distributed and announced based on those needs. So the intent, according to my understanding, is not that this goes directly to school systems, but that it goes to entities that are able to provide those services. Now, there may be a situation where a school system says, hey, we have a plan, or we partnered with people to be able to provide this service based on this need. And that's definitely a possibility. But as far as specifics, the law doesn't say it has to go to school districts. It just says it has to be used for this purpose. So again, the department will be conducting a needs assessment based on this information, and then determining what services and funding need to be allocated based on that. So like I said, really excited that we're going to have that opportunity. And again, it's a sizable investment and a creative way to use non-recurring funding that was in abundance to fund hopefully a recurring and ongoing need in the state. So like I said, something that's very exciting, very creative, and unique. And we're excited to see how that plays out over the next several years. Moving on to page 4, quite a few things on this list. The first thing, Senate Bill 207, House Bill 215. This is related to sober living homes and recovery residences, desired by the General Assembly to have some ability for those homes to have national standards or state organization standards. And there are some requirements for sober living homes and recovery residences to be certified in order to receive some referrals. So this is a big piece of legislation, something that a lot of folks that are in that space will probably need to talk about with their leadership. But it's something that the legislature wanted to see and changed as they've seen certain issues pop up in the last couple of years. Senate Bill 558, House Bill 1132. You probably have heard over the last few years that states and local governments have been involved in lawsuits related to opioid manufacturers. And this bill specifically allows for the funds that are settled in those cases to be placed into a fund and distributed both to local governments and to a state entity called the Tennessee Opioid Abatement Council that will also distribute funds for programming to abate the issues surrounding the opioid epidemic in Tennessee. So this is a new program. This council will be independent, but will also be administratively attached to the department. So there will be a lot of input from individuals that are in our space for funding related to this. Senate Bill 118, House Bill 490. This bill creates the Medical Cannabis Commission. This does not legalize medical cannabis in Tennessee, but it requires this commission to come up with a plan for potential implementation if the federal government decides to deschedule marijuana. It also created a larger limit for products with THC. These are not consumables or smokable products, but certain cannabidiol oils that individuals are allowed to possess for certain health conditions. So that was a piece of legislation that passed during the last legislative session. Next, you have Senate Bill 1265, House Bill 508. With the various executive orders that were in place and the flexibility around those, we saw that there were several situations where graduate students and other students that are in medical training programs weren't able to get their clinical hours unless they were authorized to use telehealth under supervision. So this law will continue some of that executive order provisions so that those folks can get their clinical hours in a remote setting if needed. Moving on to the next page. This is state government related legislation. I know a lot of people aren't as excited about these bills, but it does really provide a lot of guidance for the work that we do. The first two bills are sunset laws, and I know a lot of you are familiar that state government entities are all reviewed by the legislature on a periodic basis. And this was our year to go in front of the legislature to do that. And both the department and the Statewide Planning and Policy Council were extended by the legislature until June 30th of 2025. So very grateful that the legislature kept us in existence. We had a very productive conversation with the legislature during this process, and we're excited that both the statewide council and the department were extended during this legislative session. The last bill on this page, Senate Bill 773, House Bill 779, was an administration bill where departments that needed certain provisions of executive orders or emergency provisions that happened during the COVID pandemic, if they needed those to continue, this bill gave a vehicle to do that. Most of the provisions in this bill actually deal with the Department of Labor, but there is one provision in the bill that is related to mental health and specifically the transportation of patients from their first evaluation for inpatient psychiatric hospitalization. It allows the transportation agent or the sheriff's deputy in that area to, instead of having to receive a physical copy of that first certificate of need document, they can accept an electronic copy. And again, because of the evaluations that are occurring via telehealth, teleaudio, there may not be a paper form generated, and an electronic copy is sufficient for this purpose. So it just made that clear in statute and gave that ability to those transportation agents to be able to do that. In the criminal justice and juvenile justice related section, starting on page 10 here, the two bills highlighted on this page were the governor's criminal justice reform bills that I'm sure many of you have heard about. Senate Bill 767, House Bill 784, Public Chapter 409 deals with community-based alternatives to incarceration, giving more flexibility to find alternatives to do that, and create some measures for community corrections and probation to be able to gather data on that. And then the next bill, which is now Public Chapter 410, relates to reentry and provisions for those who are incarcerated that will soon be released. So two big pieces of legislation on the criminal justice front. I will not pretend to be an expert on those at all, but we thought they were very important for inclusion, specifically because of the alternatives to incarceration and services on the reentry side that our department works with that population to provide. And then finally, I think that is all of the highlighted bills on my list. Obviously, there are far more bills on the summary for your review, and hope that you'll take an opportunity to take a look at that when you get a moment. And happy to answer any questions for anything I discuss or anything else that you saw of interest.
This is Rachel again. So just to clarify, I saw on their permitless carry of a firearm is now, was that
Yes.
also passed? Okay.
Yes. That went into effect on July 1. Like I said, I will not pretend to be an expert on that particular piece of legislation either. The idea on the permitless carry is it's a little different than a lot of other states that refer to constitutional carry laws. But it essentially, if you are legally allowed to possess a firearm, you can carry anywhere where a current permit holder can carry without having to obtain a permit. So a lot of people have interpreted it as I can just carry anywhere I want. That is not necessarily the case. So again, it extended the ability for those that are legally qualified to have a firearm to possess one and carry one without a permit, but only in places where current permit holders are allowed to do. Didn't change the posting requirements and things of that nature. So that, I don't know how helpful that information is, but that's about the limit of my expertise on that particular subject.
Okay. And I really like, Rachel, thank you for asking questions, because really I feel like we've got Zach and we can ask all these questions about all this stuff in legislation that, to be honest, is like beyond where my head normally goes. And so we get to have access to this information and get clarification. So please don't hesitate to ask. And thank you, Rachel, for your questions. Are there any other questions for Zach at this time? If not, I will move along on our agenda. Next on our agenda is membership applications. As Kirby mentioned, we're in our new fiscal year and we have our new secretary and we have a lot of new faces with our group here. And so we want to make sure that we've got everyone's information. It's been a little difficult virtually for sure. So what we would like to do, there is an actual membership application that you fill out, and it's not like you're going to get rejected. It's just gathering information on who you are and if you're a service recipient or if you're with an entity or a service provider, that we have that information to show who our membership consists of. And if there's gaps, this is a great way for us to then say, hey, we need to reach out to people in this area or that area to make sure that we have the most diversified group and make sure that everyone's voice is heard. So what we will be doing, and Kirby, you can, I believe that when we fill out the application, we then send it to the department. And I feel like when I filled out mine, it was something that I filled out online by linking it. But I also want to make sure that we can send them out in a Word document that people can then print off and fill out. I want to make it as easy as possible for people to get their information back to us.
Yes, we have an Adobe document, but it's fillable, so you can fill it out. I'll send that to you in an email. And then you can, if anybody on this call is interested in becoming a member, send an email to Danielle and Gail, and they'll send you the membership application. And then once you return it, what you'll do, Gail, is you and Danielle will keep it on hand, but you'll also send it to me and I'll keep it on hand too, so that we just have two individuals. And then you just update your membership list.
Excellent. And part of this application includes your email address and a phone number. And I know that over the past couple of years, for sure, we've struggled with that. People have requested to be added to the email list, and it's not been as consistent. We are all very dedicated to make sure that this happens moving forward. So by filling out an application, becoming a member, you're going to get all this information via email. And if you're missing and we're not hearing from you, more than likely someone's going to reach out and make sure everything's okay and see what we can do to get you re-engaged. So thank you. We'll be sending that out, and please take the time to fill it out and send it back in. And if you need any help, let us know.
Gail, can I ask a question? It's Debbie with Cactus. I know through the years we've become members. I'm assuming if you are a member, you need to re-up that at this point. I know several of us on this call have done several through the years, but this is everybody across the board, whether you've done them previously or not.
At this particular moment, Debbie, I would ask that we do that. You know, it's not like your membership expires, but I think it would be very helpful at this time for us to have everybody, whether you filled one out before or not, to do so again. It would just really give us a nice, clean, accurate list, which would be beneficial.
And you may know this, and Kirby, I'm sure you do. I know Donna and I, for years ago, we did a membership drive, so to speak, but there used to be a formula of consumers, providers, family members. Is that still in the expectations of?
So Debbie, yes. So the new membership template, we created it last year after we had our sunset audit, because it just showed some areas that we needed to improve upon. And one of those was membership lists to get a more accurate representation. In that, it actually has, it's an Excel document, and it has the percentages for, you know, and you can represent more than one. You don't need to, you don't need to just be in one category. You know, you could be 3 categories, you know? So in the past, it was a requirement for all regional councils to have at least 51% membership of service recipients and family members of service recipients. Now that's more of striving for it. So on the statewide council, because the regional councils mirror the statewide council. Well, on the statewide council, those individuals are appointed by the commissioner. Your designation is, you know, out there. Whereas the regional councils, these meetings are open to the public. Anyone can attend these meetings, and not everyone might feel comfortable with their designation. Do you know what I mean? So we couldn't force that on individuals.
Okay.
So it's more of a strive for. That's why I'm encouraging all regional councils to really strive to recruit more individuals that are service recipients or family members of service recipients. There was one more thing I was going to say, and now I'm just, and you can attend these meetings and not be a member. That's okay. But in order to vote on anything, you need to have a membership application completed. If you're not interested in that, but you just want to attend the meetings, you can get on the email listing, but you don't need to complete a membership application. So just be clear when you email Gail and Danielle, if you would like to become a member, we'll send an application. But if you would like to just be a guest and on the email list, we can do that as well.
Thank you. I apologize. They're mowing at my facility. Do you hear we have dogs and lawnmowers today on the meeting. Sorry about that.
So I've got a couple questions here in the chat that I don't want to ignore because they're related to membership. One is whether there is a set number of voting members that we can have, Kirby. There are some entities.
No.
Okay. There are some entities that are participating that have a large number of service recipients, and I think
we would like members to be. Oh yes, we would love to have more service recipients become members. Absolutely.
yes.
But you know that if a service recipient maybe just wants to attend a few meetings before committing to be a member, that's okay too. No, there's no max numbers. Let me see. I'm going to go through some of these questions.
Great, thank you.
We just need to make sure that when we vote on things, we just want to make sure that there's a quorum of the members. That's all. So say you have a membership list and there's 30 people on the list, but only 15 of them have membership applications completed and they're members. We want to have at least 8 members on a vote. Let's see. I think a lot of it was, I think you answered a few of them already. So yeah, you don't have to complete a membership application to join a meeting. It's just to vote. And it's also just a good idea to, because jobs change, contact information changes. It's good to just redo all of these applications starting now, just so we have a more accurate representation and contact information for how to reach you all. I think I answered them all.
I think so as well. I just want to make sure we got to that. And if you have other questions along the way, please don't hesitate to reach out. I know I put in my email and Danielle's email, and so we'd be happy to answer your questions. And if we don't know the answers, we will reach out to Kirby and she'll help us answer your questions. So I just wanted to touch base as we go into the committee reports to make sure everyone, I started in the beginning by talking about what our role is as a regional council. And we do have our needs assessments that will be due in April of 2022, which I know sounds like we have plenty of time, but I know that your chairs of your subcommittees are going to say, no, it comes really fast. And so if there are things that you have experienced or have heard a lot about that are related to any of these committees, the adult committee, the children and youth, or the legislative subcommittee, consider joining one of these subcommittees so that you can participate in developing the needs assessment and hopefully legislative proposals that we can submit in April of 22. Really, you don't want to be doing that last minute. You want to be working on it all year round so that you've got all the data and information that you can possibly have when you make your submission. So with that, I will just ask Trish Cunningham to give her report from the Adult Subcommittee.
Hi, everyone. So I'm super glad that Gail has given a rundown of our expectations and, the purpose of us meeting. I am new to this. I've only been to one other meeting. And so in saying that, I have had the opportunity to meet with a few members of our subcommittee, and I am still sort of gathering more information at this point, but I think I have a better understanding of sort of where we're going. And I, with some of the goals identified from the last assessment, needs assessment. So going forward, I'm planning to meet with anyone that really does want to meet about, just trying to identify some issues, and try to do that at least every other month, if that's possible, if not monthly. But I, in my role with the McNabb Center and with Tennessee Department of Mental Health and Substance Abuse Services, I conveniently work in all 23 counties. So that's sort of a built-in bonus. So I do get to work with and meet a lot of different entities out there in 23 counties. So I will be working actively to bring that representation back to this group, so that we can hear from everyone, from here all the way up to where Glenn is in Upper Cumberland. Thank you, Glenn, for being here. And so, like I said, I'm still kind of working on putting all of that together. I will be much more prepared for the next meeting, I promise. And Kirby has graciously agreed to meet with me for more technical assistance. So I will definitely have a more well-rounded presentation for the next time. But if you have any questions for me, I can drop my email in the chat. Please let anyone know that's within our 23 regions. If they want to meet and talk about this, then let's do it. I'm definitely open to that. So thank you so much.
Excellent. Thanks.
If I may, Gail, before we move, this is Debbie. Yeah. I want to say, this is Debbie with CADIS for the minutes. I want to say a thank you to Trish for stepping up to the plate. I know we talked about that earlier with another position. We had a very untimely, tragic interruption with Connie on our adult committee. And Trish, we really appreciate you stepping up. Donna and I were being kind of sub-chairs to Connie, and just, I know for myself personally was not able to devote the time to it. And I just appreciate you stepping up to the plate so much. So thank you, and I look forward to working with you.
Sure, thank you.
Thank you, Debbie. All right, Amy, I know you're on here from our Children and Youth Subcommittee.
Hi, everybody. Oh, looks like we have a question. Should we get to Cheryl's question first? It might be related to
sure.
adult.
Yep, great. Thank you. Who? I raised my hand instead of
Looks like
Cheryl, are you on there?
Cheryl Williams. Is somebody signed in for Cheryl Williams? Maybe not.
Oh, okay.
Oh, she might have been trying to clap. That's true. Yeah. I'm sure.
Oh, yay! We got a clap from Cheryl.
Yeah.
All right, Amy.
Yes. Thank you, Cheryl. Okay, so my name is Amy Irvin, and I work for Omni Community Health. I'm the director of the offices in our Southeast region here in Tennessee, and I'm also the chair of the Children and Youth Subcommittee for this council. And where do I start? I mean, first of all, I'm just super excited because we are continuing to expand our attendance to our meetings. We meet on a monthly basis. Typically, we meet at 9 a.m. Eastern time prior to this meeting, but it's every month. So it's the third Thursday of the month on 9 a.m. We did not meet today. And I'll get to that in a second. But so the first thing is our group is definitely expanding, and kind of like what Tricia alluded to, we're trying to get better representation from entire region geographically, and that's been happening, and that's super exciting, and just a lot of new faces, and just excited to have just some really broad, involvement and participation and discussion about what the issues are that we're facing. The other thing that we talked about is we were like, okay, we did a great job on our needs assessment. And I am so grateful to our regular people in attendance and our new people in attendance as we hammered out that needs assessment for 2020. And we are thinking about, or 2021 rather, that we submitted in April. The question is whether or not we want to continue to focus on those needs and gather more data or look at additional needs. And so we decided, we're like, hey, let's start thinking about other needs and having discussion. But as we alluded to in these discussions, we have to have data to back it up. And so that's what we've been talking about is here's needs, where's the data, and how do we put that and pull that together? And I think that we're getting a little bit stuck with that. And so we're just looking for some assistance from the statewide committee. And so I'm going to be attending, which I usually do, the statewide Children and Youth Committee is meeting in August. And so what we're hoping for is some more, I guess, specific conversation about how do we identify needs in our line of work and for our service recipients. We know what those needs are, but how do we connect the data there to say, yes, this is true, so that we can then present that to the commissioners, the state level for all these decisions. And we're just kind of still a little bit floundering with that. And that's okay. I think this, we all have other jobs. And so we're all just trying to figure this out together. And so Kirby was so gracious to kind of help say, yes, you guys are not the only ones thinking this. This is also conversations across the state. And so I'm hoping, Kirby, that we're going to be able to have a little bit of discussion time in the meeting that's coming up in August. And then so I'm hoping to then bring back a report to our committee at our August meeting, which is going to be held the third Thursday in August, I said, which is August the 19th at 9 a.m. So I'll be sending out that link for folks to join with those kinds of updates. And again, just to continue our conversation, we think it's important to meet monthly because there is a lot of work to be done. Once we establish these needs, we have to look at the data, we have to synthesize that and then propose that. So we'll be diligently staying the course as best we can. I'll stick my email also in the chat. If anybody has anybody that's interested in joining, we'd love to have you. Thank you.
Thank you very much, Amy. You're doing a great job. Trish has connected with you, and I appreciate all the support you've given her as well. So thank you very much. You guys are doing a great job. Nicole, I know, was going to need to get off at 11. I don't know if she's still on.
Yeah, I'm still here for Gail. So
great.
Perfect timing.
Good. Go ahead, Nicole.
Thank you. So I'm Nicole Bates with Mental Health Cooperative, and I'm the committee chair for the legislative subcommittee. First of all, I just want to say thank you to Zach for sharing all of the legislative information and the hard work that's going on there. It's just so much information that is needing to be synthesized, and for us, just impacting all of what we do. So just so everybody is aware, what we like to do is kind of take the information that now Trish and Amy kind of consolidate and collect with the adult committee along with the child and adolescent committee. And we review that information at the legislative committee and identify if there's any legislative related changes, proposals, issues that we can then escalate to the department. And so it really is, it's a trickle effect. So everything that the work that they do really feeds into the work that, that we then need to do. And of course, this year, the focus on telemedicine and the changes at that level has been very impactful. And that was one of the biggest focuses from our region that, the region identified the area that we really wanted to kind of see escalate to the department. So at this point, I love to get more engagement. I think we have a very robust population in a community that I would love to just see more engagement in the discussions at the legislative level. And also at that point, anything that really comes up within your area of focus, that we could then, dive deeper into data collecting, and trying to determine if that is indeed a need that we would like to escalate to the legislative statewide committee. So at this point, we will be meeting. Of course, like I said, it is something that we, kind of all need to collaborate on. It is a joint effort, and we'll be looking forward to doing that legislative work going forward. And if you are interested or have somebody that you think would be a great fit for this legislative subcommittee, please reach out. I'll stick my information in the chat. And this is definitely an exciting time where we can, really move forward with some changes that can be impactful to our region specifically. And I see a lot of stuff in the chat. I'll look at that shortly.
No worries. Thank you very much, Nicole. We appreciate it. At this time, I am opening up for any consumer updates, questions that they may have. And Rachel, I kind of pulled you in there to just help if there's people that you've been speaking to that you want to make sure their voice is heard. We'll just take a few minutes to allow other people to share with us what's going on.
Yeah, I think that we just, sharing from my end, I think that we mentioned several times in this meeting the need to make sure that we have former service recipients, current service recipients, family members, anyone who has any lived experience of mental illness at the table. Those of you who know me know this is a huge passion point, and making sure that we have folks with lived experience, especially in the needs assessment point. So I'm trying to be a lot more intentional about, and Gail, I like that you at the beginning said, this is why we're here, this is what we're doing. I think it's a really great opportunity for people with lived experience to engage with the department, to learn about legislation, to learn about programs, to meet the providers in the area. So I would just encourage everyone to be intentional about bringing people to the table, and also for all of us to be intentional about making sure that we're welcoming individuals with lived experience and making this a meeting that they can fruitfully participate in.
Is there any, I think someone from Nami is on this call, is that correct?
Yeah, we have several Nami people.
Excellent. Is there anyone that'd be willing to speak up and share what's going on in your world right now? Events, outreach. I know it's been a challenging year, so is there anything that would be helpful for us to all know?
Yeah, I'm Kathy Milam, and I'm the president of Nami Chattanooga, and we are really boots on the ground dealing with mental health issues every day. We have a helpline. We get a lot of calls. One of the things we're seeing in our area is a huge backup in the ERs. It's a problem. There are not enough beds, not enough beds. We need beds for people. I don't know that anybody ever really talks about that. And that's one thing. I mean, my daughter for sure has sat in a waiting room of the crisis center 3 days and nights waiting on a bed. That's the reality. That's the stuff we deal with here. So, yeah, we are virtual. We are having support group meetings. They're going fabulously. We teach classes. We believe that if we can help families deal with a mental illness in their home, there will be less homelessness. There will be more early intervention. We need to educate families, and that's what we're all about too. So, what's going on? We are having a big event in October. I'd love you all to be participating and be sponsors. We have recorded our stories, our personal stories through our journeys of mental illness with our loved ones, and they are very moving And that's going to be the basis. It's called Nami Narratives, Finding Courage in Mental Illness. And we want to open this up. We want people to see you don't have to survive mental illness on your own. There is help. It's going to be at Coolidge Park on October the 9th. It's going to be amazing. We're going to have speakers. Some of them are secret that I cannot divulge yet, but they're important people. They're going to be there. So I can send you all information on it. That's what's going on here. I hope I answered what you wanted me to say. Thank you.
You did. Great job. Thank you, Kathy. I really appreciate it. Is there anyone else that has something going on with a community-based entity that we would like to offer the opportunity to hear from you? And if not, I encourage you to consider joining one of the subcommittees, so that if your heart pulls you to children and youth issues or to adult issues, get with Amy or Trish, and your voice can be heard that way as well through that subcommittee work. So please don't hesitate to do that. I will move on to the provider and other community announcements. I think someone mentioned they're on from a hospital. Do we have any of the mental health hospitals? I don't know if we have anyone from Moccasin Bend, Park Ridge, Erlanger. Okay, well,
we may also have medical hospitals too.
Is anyone on from any of our regional medical facilities?
Hey, this is Jenny Dillard. I'm the Director of Operations for Emergency Services at CHI Memorial for all three of our ERs. So thank you for letting me join today. And I appreciate how you started the meeting with the purpose.
Good.
So that I could understand, this meeting and the purpose of this group.
Okay, so thank you for joining. I really appreciate it. And is there anything, I think you heard from Kathy, we've got people coming into the ERs and sitting there waiting. I'm sure you experienced that on your end.
Yeah, absolutely. Sorry, go ahead.
No, that's okay. Is there anything that you're looking at right now internally related to individuals that you're serving with mental health and substance abuse issues?
We have started, we use the telehealth with Moccasin Bend, but that doesn't really decrease our length of stay as much. We have started some telepsych services that we're utilizing after we've signed a CON just for evaluation or follow-up. I've also been working with, I think Kristen from Park Ridge Valley. Is that her name? Kristen? Just on some materials our materials are outdated for anyone that is requesting mental health outpatient treatment or that we think could benefit from something on discharge, even if they're not there as a CON for mental health issues. So she's updating that for me so that I can give those away to patients that might need follow-up. So right now we're just working as hard as we can to get these patients in. We usually, when a patient comes in and is suicidal, they won't sit in our lobby. We'll immediately bring them back. But we are working on our length of stay because we don't want to keep people here against their will either once their suicidal thoughts have cleared and they can get outpatient treatment.
Excellent. Thank you very much. Any other hospital representative, whether it's medical or specific to mental health? Do we, that's a problem. I'll just say that out loud. So I just marked that as something we need to work on. Jennifer, don't go away. Keep coming back each time because we need you. You're a key part to how we can help our participants get the services they need as quickly as possible. So thank you.
Thank you for inviting me. I'm excited to be a part of this group and be in the know and the loop.
Excellent.
I thought Kristen was on. Is she not on anymore, Kristen? Did you have to leave? maybe. She was on at one point with Park Ridge Valley.
Well, we'll get her back. Don't you worry there, Rachel. Okay, so Department of Mental Health Consumer Advisory Board, do we have a representative to update?
Yeah, this is Gina Turley. I'm here.
Great, Gina.
We have some openings currently. Region 2, they are looking for someone with lived experience in mental health. Region 4, again, someone with lived experience in mental health and substance abuse disorder, 2 different positions. And in Region 5, one person is needed to represent people with lived experience in mental health. And so if you have any coworkers, colleagues, friends, family members that you think would like to serve on the CAB, I will put Dina Stevens' contact information in the chat. They would contact her. She's the chair. And we meet once a month and discuss things that are happening across Tennessee. We have the Certified Peer Recovery Specialist Conference coming up. It will be October 7th and 8th. It will be virtual and at no cost. So, does anyone have any questions?
I do. I'm sorry, Gina. I was wondering if you knew or if you could help me. I've recently learned that the CDSMP certification that is, I think it might be going on this week, the training is virtual training, and there's some confusion as to whether if you go through the virtual training, whether you can provide a face-to-face training within your natural setting. There's some wording that made one of my staff think that they were only then certified to perform CDSMP virtually.
I don't know, but I'll try and find that out for you.
Thank you. Okay, I think my United Healthcare is on, correct?
Hello.
Yes, hello.
Hi, I'm Kubra with United Healthcare Community Plan. We're here again, I do say this, supporting and sponsoring the community events. I'm very sorry, Donna. I've checked on your check. It has been approved. It's sitting in the system. I'm so sorry. They changed the system, so there's some hiccups in the computer system. So it has delayed our checks, but I'm still here supporting the community, sponsoring events. Please reach out to us, United Healthcare Community Plan. Thank you.
Thank you, Kubra. Rachel posted a good question. I'm sorry. I said I wasn't going to do any acronyms. I was going to say everything, and I just said CDSMP and DSMP. So when there are certain evidence-based interventions and curriculums that are used by certified peer support specialists, and these are provided both in, it can be in the community, it can be in small group, or it can be at our peer support centers. And of course, you asked me what exactly does CDSMP stand for, and I went, oh my God, my mind just went blank. Gina, can you, it's disease management. It's so it's a way to look at what an individual's experiencing, both physically as well as with their mental health or co-occurring substance abuse, and to identify, and again, it's a curriculum. And so someone has to be trained in it in order to then do it with other members to help them develop a plan. So there's a number of different interventions, but what it exactly, it's disease management. I don't know. Anybody on the call can help me out here.
Gail, I just looked it up. It's chronic disease self-management.
Thank you, Trish. And then maybe program, and then again, it's a curriculum. And so it's a really beneficial way to support people and help them understand, I always need a reminder when I'm feeling a certain way. Why am I feeling that way? And then I think of all the things going on and what I'm doing to help myself and what I'm not doing to help myself. And it goes along with that to help people with a nice plan. So thank you. Do we have anyone on from Blue Care or TenCare Select? Okay, we'll look to that. And then I don't think we have anyone from AmeriGroup either, do we?
Before we move on, though, I want to maybe just ask Cooper and the group to think about, one of the things as we think about data collection is, the MCOs have data and, on different usage and things. And we wondered if that's something that maybe we can kind of pull together or like, I don't know how much that can be shared because, but just throwing that out there.
We have been approached before. We can share some data. We can't share personal data, of course. There's HIPAA. So we have to be very, very careful. We're very strictly governed by TenCare, as you know, controlled. So whatever they can allow us to share, we'll be happy to share. I can find out if you need any information, or, please send me an email and I can find out if we can share that data with you or not. If it is shareable, we will share.
That's awesome.
Good thinking, Amy.
I'm going to take you up on that.
Good thinking. Excellent. And so I did not do this intentionally, but I kind of like that I did it. Now we have a bunch of providers, and I would like to open it up if any providers have any updates to share with this group.
Hi, this is Donna with AIM Center, and what I would like to present is a community announcement, more so than an AIM Center announcement. Dr. Dave Buck with the Autism Association and I are the co-chairs for the subgroup for vulnerable populations with disabilities for the vaccination, education, and get vaccinated campaign. That's one here. And this, as y'all know, Blue Cross Blue Shield Foundation funded or put up some money. And so these campaigns are running in various, all across the state. But this information and what I can share for you is specific to Hamilton County. But if anybody needs any help in accessing anything in other counties, I'm happy to try to get you connected. Just what I would like to say to you is that there's information available. If any of our service providers, I've reached out to some on this call, but I don't have everybody's contact information to see if there's information, if you can use flyers, if you would like buttons, if you need any type of assistance, that you may not already have. And I think a lot of times we think we're well keyed in as being part of the health community, but still there may be some gaps, and we certainly are working real hard to fill those gaps and to present viable, understandable information about this vaccine and the need, we would prejudiciously say, to get the vaccine. But, it's not a pressure campaign. As you know, there's a lot of partners in this, and a lot of people, even though this is funded by this foundation, many other places, United Healthcare has got their own drive. There is such a drive across the state because this is a commitment by everybody to help improve our health going forward. But certainly many of us serve very vulnerable persons because of their high risk physical health issues that they deal with. So this coming Saturday, the final plug is there is another community event here in Chattanooga at East Lake area on Dodson Avenue. So I would just say if anybody needs any information or would like any further support from this group for your organizations, if you could either be in touch with me, reach out to Dave Buck. Community Foundation is heading this up. And there's just lots of vulnerable populations we're trying to work with. So thank you.
Excellent. Thank you very much. That's extremely important. Anyone else have an update?
What do I do to raise that? Hey, Gail, this is Debbie at Cadis. we are going to have an open house soon about the detox unit that opened in a pandemic. So I will get that information out to everyone. So we're hoping that we can organize something that's on site here. Is that feedback from me? I don't know. But anyway, I will get something out. We are going to try to host a live event and have people over. It'll be good to see some people in person again when we feel safe to do so, and can travel here for a little bit of an open house. Our detox unit's beautiful. It's crazy. It's been opened in a pandemic, and we're excited to let the community see it. We've had a virtual tour of it. I know some of you have seen that, but it'll be better to see you guys in person.
Excellent. Thank you, Debbie. And that'll definitely help get some people out of the emergency rooms and to a facility where they can detox from substances and continue to get their linkage for help. So thank you. That's wonderful. Mary's wanting to talk. Go ahead, Mary.
Hi, this is Mary Linden, Mary Linden Salter, and I'm the Executive Director of TADIS. Since these are virtual, I have the good fortune to be able to drop in from time to time, so thank you. I wanted to say, especially in response to the emergency room bed shortage comments, that there is a statewide work group that's working on two issues right now. One is capacity for diversion programs, diversion and deflection, they're calling it, so that people can be diverted potentially even before they're in crisis and hooked up with services. And the other is kind of a subcommittee of that work group where we're working on specific diversion capacities for people who've experienced overdose or need immediate access to addiction treatment. So our addiction and overdose subcommittee has only met twice now, but the overall, diversion and deflection work group has been in place for a couple years. So that diversion and deflection conversation, I think, is gaining steam, and hopefully the same will happen with the overdose and addiction diversion capacity.
Thank you very much, Mary. Very, I love the creativity in trying to look at how we can prevent things before. Prevention is never, we need more prevention is what I want to say. And I just want to also share that Mary, when she said she's with TADIS, that's the Tennessee Association of Drug and Alcohol Services, correct, Mary? Did I say that accurately?
Tennessee Association of Alcohol, Drug, and Other Addiction Services.
Thank you.
Which is why we always just say TADIS.
And I understand. I just want to make sure everyone on our call knows. And then I have a question here of, are those meetings that you're having open? And if so, what does someone need to do to be able to join? Okay, you're answering. Great.
Anybody who wants to be part of that work group, just I'll put my email in the chat, but we would welcome participants specifically. And I actually chair the A&D and overdose subcommittee, so would love to have input into that.
And if you want to become a member, you can do that as well. Right, Mary?
Yes, Brad is from the TADIS membership committee doing his job.
Excellent. Any other updates? These are great updates, very relevant to everyone that's on the call and to what's going on both in the state and locally. So is there anyone else that has something that as they're listening they feel would be beneficial for all of us to know?
Hey, Mary, do you want to talk about the workforce development shortage and some of the efforts going on toward that?
I can definitely do so. So the Department of Mental Health and Substance Abuse, Commissioner Williams and TennCare, specifically Mary Shelton, are co-convening a provider workforce shortage statewide committee. That committee has met for the second time this week. and we, as of this week, and we have reviewed a lot of data around everything from provider pay scales to the number of people coming out of social work programs around the state, to workforce shortage areas around the state, both for psychiatrists and clinicians. A lot of data has been shared. We brainstormed a list of short-term and long-term goals at the past meeting. And our next meeting, we will begin to work on a report. The plan is to meet no more than 4 times. That report is slated to go to the governor and the governor's staff to inform potential legislation that might do things like provide for new provider rate increases and do other things to incentivize, like social work education, tuition reimbursement. We have had a lot of discussions around staff development and clinical supervision and how that keeps people in the field. I'll tell you one really cool idea that came through there, and just to pique your interest, is that, you know, how hospitals are designated as teaching facilities. What we want to try to get the department or the state to do is designate behavioral health agencies as teaching facilities so they can get reimbursement for supervision and clinical work with supervisees. That would take some of the onus off of what the provider rates have to pay for as well. So that's just one of the, I think, brilliant ideas that has come through this work group. So so there's a lot of momentum around this. The governor and others will be approached. The state legislature will be approached. We're really confident, because of Commissioner and TennCare's support on this, that there will be some legislation that addresses those issues. So.
Wonderful. Thank you. Any other updates from any providers? I think this is as quiet as I've ever experienced providers being. Okay. Well, if there's nothing else, I will look to adjourn the meeting. Our next meeting will be October 21st. I think we will need to wait to hear, correct, Kirby, as to whether that will be face-to-face, or are we sure that it'll be face-to-face?
We're not sure yet. We'll reassess around that time, and we'll give you all plenty of notice.
Okay. And we'll make sure that we communicate that with everybody. It will be at the same time. It'll be 9 o'clock Central Time at 10 o'clock Eastern Time. And if there's nothing else, then we will adjourn for today. And I just want to thank everyone for coming and for your participation. Bye.
Thanks all.
Great meeting, everybody. Thank you.
Bye. Thank you, guys.